The question is that the document be noted. I call the member for Boothby.
Thank you, Mr Deputy Speaker, and I'm pleased to speak on the Closing the Gap statement. And it's now been 6 years since Prime Minister Rudd made the apology and began the Closing the Gap program. And it's a good time to do a stocktake to see how we are doing on the goals that were set at that time. I think it's well known that for Prime Minister Abbott, Indigenous affairs is something which is very close to his heart. He has said that he wants to spend a week each year in a remote community, and he'll be doing that in Arnhem Land this year. He's taken time off to work in communities in Cape York to get a real sense of what sort of problems those communities are dealing with. I wanted to speak specifically about the health of Aboriginal and Torres Strait Islander people. And while it's true that they are improving in many areas, there is still a long way to go. And one of the goals of Closing the Gap is improving the health of Indigenous Australians. One area where, for limited cost, we could see large improvements that will last over lifetime is making sure that all Indigenous Australians get the type of antenatal care that every Australian should expect. Because what we know that problems later in life, the higher prevalence of diabetes and problems with general health relate very much to the antenatal environment that people have had before they're born. So if we don't address having good antenatal care for Indigenous Australians, then these problems will continue throughout their life. The government is working with the National Congress of Australia's First Peoples, the National Aboriginal Community Controlled Health Organisation and state and territory governments to create a 10-year National Aboriginal and Torres Strait Islander health plan. A comprehensive approach to chronic disease management is being undertaken throughout local health services, encouraging people in communities to undergo health checks and ensuring systematic follow-ups. One of the parts in the Closing the Gap which was good, was the recognition that you had to do a lot through primary care, to do it through general practices. Because while a lot of Indigenous people use the NACCHOs, the National Aboriginal Community Controlled Health Organisations, something like 50% will go to a GP who is not a NACCHO. And there were incentives on the MBS for people to give Indigenous health checks for Aboriginal and Torres Strait Islanders. On the most recent figures, the life expectancy for Aboriginal and Torres Strait Islanders is 10.6 years lower than that of the non-Indigenous population for males. So an Aboriginal or Torres Strait Islander could expect, born in 2010 to 2012, to live to 69.1. For women, it's 73.7. But what we see is that the life expectancy is about a decade. And one of the goals of Closing the Gap was to reduce the gap in life expectancy within a decade. And what the report card shows is that the Northern Territory is on track to meet this target, but the Northern Territory is the only area which is on track to meet this target. What we've seen since 2005 to 2007, Indigenous life expectancy at birth for boys has increased by 1.6 years and by 0.6 years for girls. And we've seen a small narrowing of the gap between Indigenous and non-Indigenous life expectancy for both men and women, but very small for women. So there have been small improvements in Indigenous life expectancy, but a lot more needs to be done for the future of Indigenous Australians. It's clear that we're still failing to make progress in many areas. There are still twice as many Aboriginal and Torres Strait Islander infants are born of low birth weight compared with non-Indigenous infants. Only 1% of people working in the health workforce are Indigenous. Indigenous death rates are highest compared with non-Indigenous rates in the ages of 25 to 64. And the causes of death with the largest contribution to excess mortality are circulatory diseases, external causes, neoplasms, respiratory diseases, and endocrine, metabolic and nutritional disorders like diabetes. There are a lot of risk factors that lead to excess Indigenous mortality. They have much higher rates of tobacco smoking, much higher rates of excessive alcohol consumption, higher rates of overweight and obesity, poor nutrition, and they use health services less. When we look at mortality rates for Indigenous children, there is encouraging news there. One of the goals was to halve the gap in mortality rates for Indigenous children under 5 within a decade. And if the trend over the last 15 years continues, we should achieve that target by 2018. But this is really, this Closing the Gap statement, it's an interim report card. It shows that Northern Territory, for example, is doing very well in closing the gap in life expectancy, and that there has been improvement in reducing mortality rates for Indigenous children, but there's still a lot more to be done.